Well, warm welcome to today's talk, Sunday the 21st of November. Now, we've got some hard data now on the likelihood that having COVID at the time of delivery or round about the time of delivery of a baby will increase the risk of stillbirth. And it does increase it. Now, you might remember way back at the start of this pandemic, we actually did a talk on this where we were looking at data from Singapore on women who delivered during SARS coronavirus 1. And there was a lot of miscarriages there, and we were really quite worried at the time. It hasn't panned out as bad as SARS coronavirus 1 did, but there's still a problem. So let's look at this fairly definitive data now that we have in. And the other kind of thing to get from this video is it's worse with the Delta variant as well than it was with the original variants. Now, this is from this recent release paper here from the Centers for Disease Control. Now, the Centers for Disease Control gets plenty of critique, of course, but they are very good at collecting a lot of numbers. Now, this article is intelligible, but it does contain quite a lot of numbers. But that's good because we like to try and quantify things if we possibly can, so we know exactly what the risks are. So let's get into that now. So risk for stillbirth among women with and without COVID-19. So it's comparing women with COVID-19 and women without COVID-19 when they were admitted to the delivery hospital in the United States. And this data takes us from March 2020 all the way through to September 2021. So it's a fair old chunk of data there. Check it out for yourself. All the information's there in that paper. And as I say, it is a reasonably intelligible paper. You should be able to get to grips with that if this is a particular interest that you have. Now, background here, what do we already know? Well, pregnant women are at increased risk for severe COVID-19 related illness. I'm afraid we now know this now. COVID-19 is associated with an increased risk for adverse pregnancy outcomes. Again, we know this, but we wanted to quantify it. And maternal and neonatal complications. So greater risk to the mother, greater risk to the newborn baby, the neonate. Now, I must say, when I started to look at this, and of course it's hard to imagine losing a child is the ultimate tragedy, of course, for any parents, the ultimate tragedy in this world, really. And it is surprising how common stillbirth is, where the baby is delivered dead. So here we have the figures. So this is late fetal life in orange. So this is 1990, and we see that here it was 4 in 1,000. Remarkably high, over 2%. I was really quite surprised, and this is for the States as a whole. Now, it is coming down quite a bit, this orange line, which is late fetal life. But still, we're still looking at, 2.7 per 1,000. So I must say it's more common than I had suspected. And the figures from the UK aren't a lot better, and I think Scotland's even a bit worse than England. So stillbirths during March 2020 to September 2021. Well, in this period of time in the States, the CDC logged 1,249,634 deliveries altogether. Stillbirths among those, the rate was 0.65%, so there was 8,154 stillbirths. So really quite a lot of tragedies, isn't it? 8,154. 0.65% of births. So higher, as I've said, higher than I expected that it would be. There was 21,653 deliveries to women with COVID-19 at the delivery hospital. And out of those, tragically, there was 273 stillbirths, which represents 1.26%. So we can see that if we take the total number here, so this is the total number, and then we take those with COVID-19 at the time of delivery, the risk over the whole period was greater in terms of stillbirth with patients with mothers presenting with COVID-19 at the time of delivery. So that's a definite increase over the period of time, and this is based on such large numbers. This is pretty definitive data now, really. Large numbers, pretty convincing, really. Now, 1,000 227,981 deliveries without COVID-19 in this period. So that's March 20 to September 21. And the overall neonatal death rate there, stillbirth rate, was 0.64%. So just a little bit, just to remind ourselves, the overall was 0.65 when we included the COVID cases. 1.26 for the COVID cases alone, the 21,000 of them, with the 273 deaths, children's deaths, stillbirths. So that takes that down to 0.64% for people for women without COVID, but their children without COVID. But the pre-pandemic stillbirth rate over the past few years has been 0.59. So we see that in the COVID year, stillbirths were actually a fair bit higher than in the previous year or two. And in fact, I think that's probably the average of 5 years. Now, CDC don't make an issue of this. They sort of say it's comparable, but I think they're glossing over this a bit. I think with these numbers, that would be a highly significant difference, actually. So I think tragically what has happened here is that there's been the number of stillbirths is increased during the COVID pandemic, probably partly because, remember these were mothers that deliverers without COVID at the time of delivery. This could have been partly because mothers had COVID in pregnancy and then got better. That's possible because this isn't tracking that. So, for example, this could be increased because mothers had COVID in the first trimester or the second trimester, the first 3 months or the second 3 months of pregnancy. That's possible. Because I do believe that 0.64% is statistically higher than the previous year's 0.59. And the other thing it could be is, were mothers less likely to seek maternal care from professionals, which is another fairly sobering thought, that there could be more stillbirths because healthcare wasn't always accessed as frequently as it could have been. So results March 2020 to September 21 for COVID infection. The adjusted relative risk is 1.9. So the overall figure, if you had COVID, the risk is 1.9. If you didn't, the risk is 1. So it's basically a ratio. No COVID, there would be 1. With COVID, there would be 1.9. In other words, about a 90% chance in increasing risk of stillbirth with COVID-19 at the time of delivery over that period of time. Not quite doubled, but not too far off it. So I'm afraid there's a definite increase in risk of stillbirths there. And when we look at the number of children with stillbirths in that COVID period, 273, we are looking at quite a few children, unfortunately, that didn't make it to neonatal life as a result of the pandemic, which of course is a tragedy. And it's reasonable to assume, quite reasonable to assume, that in other developed countries like Europe and the United Kingdom, these figures would be comparable. And it's also, I'm afraid, reasonable to assume that in less developed countries, or where there's less healthcare available, the number of stillbirths would have been higher still as a result of COVID, unfortunately. Now, what about the difference by variants? Now, to work out the difference by variants, CDC broke this down by time. So March 2020 to June 2021. Now, this was the time of the wild variant. This was also the time of the alpha variant, but it was in the pre-Delta period. So before the Delta period, the relative risk was 1.47. In other words, 47% more likely to have a stillbirth with COVID than without COVID. So still pretty significant, 0.98 of the COVID-19 affected deliveries resulted in stillbirths. So getting on for 1% of mothers presenting with COVID had a stillbirth. So that's in the March 2020 to June 2021, in the pre-Delta period. So basically we have a group there in the pre-Delta period. Now, if we compare that to the Delta period, which basically constitutes another group for comparison. So this is the separate group here in the Delta period. So that was from July to September 2021. Now, of course, this was ongoing past September, but this is what the data is available for. The adjusted relative risk, when they adjusted for other factors, was 4.4. So mothers with COVID 4 times more likely to die with Delta variant than mothers without COVID, and that really is quite that's quite a significant increase in the adjusted relative risk. So pretty sobering figures, really. It's quite a sobering talk to prepare this. 2.7% of COVID-affected deliveries resulted in stillbirth, as opposed to 0.98 in the pre-COVID period, as opposed to 0.59 in the years before, as opposed to 0.64 in the COVID year. So we see quite big increases, really. Now let's look at some of the implications here, and the CDC gives implications for this. And I also want to show you something that's also pretty sobering from the States. If I have it here, yes, I think I do. And it's this. Now, this is the rate of stillbirth varying by race and ethnicity. Fetal death public use file. This was in 2017, so this is the latest data on the CDC site. So we see here that in the total there was 5.98 stillbirths per 1,000 deliveries. Still pretty high, I would have thought. Non-Hispanic whites, it was 4.89. Non-Hispanic blacks, it was 10.3. In other words, just over 1%, 10.3 per 1,000. American, Indian or Alaska natives, 7.22. Asian or Pacific Islanders, actually the lowest grouping there, 4.29. And Hispanics, 5.1. Now I believe the Hispanics, although we don't have firm data on that the Hispanic death rate, stillbirth rate is actually even higher than that now, unfortunately. So some pretty sobering facts there already from the States, from 2017. But getting back to this year, implementing evidence-based COVID-19 preventative strategies. So basically the CDC is saying, well, we don't want pregnant women to get COVID-19. And the CDC, direct quote, including vaccination before or... I always think, I haven't got hard evidence for this, but I always think it's by far best to get vaccines before pregnancy. We call this sort of perinatal health, really. Preparing, getting the parents in optimum condition, if you like, before the conception occurs. So, for example, absolutely vital that dad stop smoking, because there's some evidence that shows if dad is smoking at the time conception occurs, childhood cancers are more likely to occur from the damage that the smoker's done to the father's sperm. And of course, the mother wants to be in optimum health, optimum nutrition, and optimum state of immunity. I think that's fairly obvious. So ideally before, but if not during pregnancy, is the CDC advice. So the vaccine here is really being pointed out as a way of reducing the risk of stillbirth. It's critical to reduce the impact of COVID-19 on stillbirth. So these things are critical because we want as few of these stillbirths, of course, as we can possibly get. So we agree with that statement. Stillbirths in this context defined as fetal death at greater than or equal to 20 weeks gestation. Of course, you have a completely recognisable, recognisable child at that stage, and really quite a tragic situation. 53% of women were non-Hispanic white. So that's a risk. 57% of women were non-Hispanic white. In other words, they were white. So 57% were white altogether. 53.7% were white altogether. 50.6% had private insurance, which is a factor. 15.4% had obesity, 11.2% had diabetes, 7.2% had a hypertensive disorder. So again, all of these things could be optimised. The healthcare availability ideally would be optimised before pregnancy. Obesity ideally would be corrected. Diabetes would be well maintained. Now, diabetes can occur in pregnancy, And if it does occur in pregnancy, gestational diabetes, it's very important to control it very precisely. Otherwise, you end up with positively huge babies, because the excess amounts of insulin produced by the mother and the baby stimulate the growth of the tissues. So you don't want to end up with these huge diabetic babies that can be difficult to deliver. Hypertension is a particular risk to the placenta. 1.8% had a multi-gestational pregnancy, in other words, twins or triplets, which is also a risk factor. And of course, 4.9% still smoking tobacco as documented. So that's really quite a few people still smoking, unfortunately. Now, the doctors have started studying the pathophysiology of this. What's going wrong? Why is this a problem? So placenta histopathologic abnormalities. Now, histology, histo is the study of tissues, pathology, of course, is disease of. So what disease is in the tissues? And there seems to be placental hypoperfusion. Hypo is low, so not enough blood going through the placenta, hypoperfusion, and inflammation. So what it looks like, just a prima facie examination of what that looks like, is that the COVID is causing inflammation in the placenta. And of course, when there's inflammation, there's swelling, and that will press on the blood vessels and reduce the perfusion of the blood through the placenta. So that's one possible, one really quick way to look at that. Might occur with maternal COVID-19 infection. So these things might occur. Need for pre and post Delta placental studies. So is there a difference in the fewer stillbirths before the Delta era with the placentas after the Delta era? Well, this hasn't been done yet. So this needs to be done. And collecting placentas normally isn't too much of a problem because we don't normally keep them. Although there is a trend now for keeping placentas, for storing placentas, and it's actually a really good idea because in the placenta, in the blood vessels in the placenta, although you try and get the blood from the placenta into the child, not my area of expertise, I'm not going to say further because I'll be corrected by obstetricians and gynecologists. So you try and get the blood from the placenta and the umbilical cord into the baby, of course, get the baby as much blood as you can. But when you actually finally do cut the cord, preferably after a suitable period of delay, and again, I'm outside my area of expertise, so do feel free to update me on this, by the way. There'll still be some blood cells left in the baby's placental blood vessels, and some of those will be stem cells. Because just around the time of birth, a lot of the stem cells, the cells that make the blood, move from the baby's liver and spleen into the bone marrow, which of course where they are after birth, and in you and me, they're in the bone marrow. And some of those stem cells, if they're stored, could be used later in life to produce a new set of blood, if you like, for the individual. So if someone's got the placenta stored and they get, for example, a severe blood disorder like a severe leukemia, it would be possible, rather than having a bone marrow transplant, that you could just give the person their own stem cells back. So I do like the idea of placental retaining and freezing. It'd have to be in very cool conditions, of course, but I haven't looked at that for a few years. Last time I looked at that was probably 4 or 5 years ago, but it does seem like a good idea. Anyway, I'll just leave that with you. But the point is, placentas aren't difficult to get, so this could be done. Mississippi, study done in Mississippi, black and Hispanic women accounted for 12 of the 15 COVID-associated deaths, despite only being 50% of the infection. So grossly, again, black and Hispanic women there, grossly overrepresented, as we saw here. But as I did mention, greater numbers of stillbirths now, sadly, in Hispanic women. And the reason here is probably mostly, well, the social conditions, there's economic conditions, of course, but there's also the risk of high blood pressure, the risk of obesity, and the other things that propose, the smoking. I don't know if there's any difference in smoking rates or not, or alcohol rates, but certainly the increase in diabetes, obesity, and hypertension are risks there. And it's just sad to see babies dying at such an early stage. It's one of the most tragic things, and quite a few of you listening, because we're dealing with about 0.5% of births here. I've got experience of this. So So there we go. We've got some firm data now. To summarise, there is a risk to the mother and baby with COVID. Delta variant causes more stillbirths at the time of delivery than the previous variant. And the previous variants cause more stillbirths than women without COVID-19 at the time. So very important that pregnant women do not get COVID-19, either by social isolation or by pre-pregnancy, or if necessary in pregnancy. Vaccination is the basic message the CDC is trying to convey, as I understand it. Okay, thank you for watching that. Now, we haven't had an update from Wefwafwa for a while, so let's get one now. Now, the first case is Mbale. She was the girl, and Wefwafwa's actually diagnosed her now with sickle cell disease, a genetic disease. Now, you can't cure the underlying disease, but he's optimised her condition, and she's doing much better now, so that's good. And then the second one is he paid a surprise visit to Ben. Now, Ben is the boy you might remember with the osteomyelitis, the bad infection in his femur. Now, again, that hasn't gone away. He's still seeing the orthopaedic surgeon, but Wefwafwa's managed to optimise it with nutrition and antibiotics, and basically Ben's pain-free for the first time in years, which is great. So it looks like Wefwafwa's just doing a social visit, but actually he's visiting with the eye of a clinician, and he's actually getting a lot of information as he visits him. So fascinating videos from Wefwafwa. Let's go to those now. And of course, Wefwafwa is our joint community health project in Uganda. Thank you, Wefwafwa.
So guys, we are going to take off the sample on Mbale. We are right now in Mbale Health Center 4. But we are going to Ginger because we've not been able to get the machine that does the liver function test and a good ultrasound scan. So we are going to Ginger and we do those tests. Then we shall buy her some medicine, and also we shall tell you the findings. I know she fears the injection, but hope everything will be okay. They'll finish taking off the sample from Bazira. They'll finish taking off the sample from Balila, and we are now going with them to Ginger, where they are going to do the ultrasound scan of the abdomen, and then we are also going to do the liver function test, and we shall also do the complete blood count. So I will tell you the findings, and we shall decide on what should be done. Otherwise, she's now looking a bit good, though the eyes are not all that normal, but the jaundice at least reduced. So I'll let you know what we shall find out when I'm back. So friends, yesterday in the evening, I went to check on Ben. I just surprised them because I'd not informed them that I was coming to visit them because Paul had told them that he had gone to Gulu and they were not aware that I'd come back. So I just went in the evening, but I was so happy to find that Ben was playing, and he was also so happy to see me. So that is how I found Ben yesterday, and I just interacted with him. Hello. Come on, listen. Hey, hello.
Hello.
Hey, greetings. Yeah. Guys, so I'm finally here at Benny's place. I just came here abruptly. I didn't tell them that I was coming. I just surprised them. I found Ben was playing and was in a very good condition. He's very happy. Yeah, and I've observed, as Paul said, there is a great improvement. Now we are preparing to take him to the hospital to see the orthopedic surgeon, and then to bring him food And then also we are going to bring him a lot of things, as you will see. Thank you very much for your support. Thank you very much for your love. Thank you very much for caring. Thank you very much for making a difference in Benny's life. And thank you for supporting all our community outreach programs. We love you all. See you in the next video. Bye. Yeah, I'm here with my guys there. See you.
Great. So it looked like Wefwafwa was just kind of messing about there, but in actual fact, he was assessing Benny, and you could see he wasn't in pain, and that's great. So he's like playing like a normal child for the first time in several years, and let's hope the orthopaedic surgeon will get that bone sorted out. Hopefully, that's what orthopaedic surgeons do, they sort out bones. Okay, so links, of course, to Wefwafwa's work if you want to get involved. Email him, he'll talk to you, he'll email you back, make a donation, whatever you'd like to do, and it all goes to the patients he's trying to help in these projects. Okay, thank you for watching.